Dear viewers, wherever you are viewing us from, you are welcome again on this telecast. Wherever you are viewing us from, keep in touch with us. You can be able to follow us on all social media platforms. If you are using Facebook, it is Pure Africa Radio 88.7, Pure Africa TV. Make sure that you follow all of our platforms on social media like YouTube, TikTok, and you'll be able to get all that we are doing. This is a season, as the way I said earlier, that it is a season for sickle cell, sanitization, and whereby I have a friend here that also has a clue about it. Can you just introduce yourself for the benefit of the viewers to know who you are?
I'm called Veronica Bitta. I'm the founder of Tumaini Sickle Cell Organization, an organization that supports people living with sickle cell disease and their caregivers. And we work in 4 main thematic areas. There is advocacy and policy, where we work with the legislators and also decision makers to change policies that are favorable to sickle cell patients and their caregivers. We do a lot of education, awareness creation, and community outreach programs where we sensitize the community about sickle cell disease. We educate them to understand what sickle cell disease is, its science, mode of transmission, management, primary prevention measures. We have a lot of patient support activities. One of them is regular blood donation drives, which we do in partnership with Kenya Red Cross and the Rotaract Club within Kisumu, especially learning institutions. We've always partnered with students from Great Lakes University, Maseno University, Uzima University, and we carry out blood mobilization drive in the community. Yeah.
That's what you do.
That is among the things we do. And we have a research department that is research and innovation, where we have a scientific advisory board that consists of health experts in different areas. Like we have a hematologist that's a specialist in blood diseases. We have we have a pathologist. We have a pharmacist. We have an IT expert in health management systems. We have a data scientist that helps us to analyze the data that we have collected during our research. We have a nutritionist because sickle cell is nutrition sensitive disease, and one of the main management techniques is through proper nutrition. Yeah, so those are some of the things that we do.
Right now, there are some other issues that when you mention about sickle cell, specific in Kenya, in Kisumu, or all the corner of Africa, you find there is a lot of people, they believe that sickle cell, it is a curse. Maybe how do you put it?
Those are actually the misconceptions and the myths that surround sickle cell disease, and that is why we do a lot of community outreach programs that are meant to educate the general public to understand what sickle cell disease is. It's not a curse. It's a blood disease that is inherited by a child when both parents carry the defective gene. The problem with it is, if you are a carrier, sickle cell is caused by 2 pair of genes. We call them HBSS. But if you are a carrier, meaning you only have 1 copy of that gene, you will not show any symptoms of the disease. You will be a healthy carrier. So a healthy carrier marrying another healthy carrier can give birth to a child who is living with or born with sickle cell disease. And among the messages we pass out there to the community is to ensure that their children go for sickle cell screening to know their sickle cell status or the genotype of their children. That is one very important message that we pass in all our community outreach programs. We also visit schools and learning institutions, even churches, just to pass that message. And we have also partnered with organizations that provide rapid test kits for the disease. Yeah, they donate to us, like we have the Ikigai sickle scan that donates, and we go out there in the public and carry out mass screening during medical camps or even just in the general public.
Okay.
Yes.
Maybe what is your message now to the viewers?
My message to the viewers is to ensure that all premarital age children, adolescents, newborns know their sickle cell status. Let them walk into any facility and request to be tested for sickle cell genes.
Thank you so much for coming, and we wish you the best.
Thank you very much too.